My name's Kent White.
Okay, Kent, and where are you from?
I'm from Nashville, Tennessee. Well, part of my history on my dental career, I started off as a chemist, and then I went to dental school, knew there was something missing, and did a couple of elective residencies, and then started working and teaching at Las Vegas Institute. So started that in '97, and ended up back in Nashville, Tennessee, and we're just doing it there now. My ultimate goal, that's really a great question. I wanted to bridge what I thought was missing between dentistry and medicine. And I really do think that's probably one of my ultimate goals, is I wanted to bridge dentistry and medicine and preserve kind of the private practice feel of the small business.
And what do you think your practice was missing that you had to reach out to Dr. Durham's course?
Well, not being a business owner, even a lover of some of the business systems, and maybe not even aware of a lot of the business systems, one of the things that was apparent to me and others was just the fact that business was not my strength. And even though it may be embarrassing, one of the things I tell others and suggest, at least, is it's okay not to be good or great, and you don't have to know everything yourself. And I think some of the dangers of dental and medical school are we're taught we have to know the answers. Everything has to be right at our fingertips, and that's just, for a lot of us, that's just a lie. If your calling or your gift is what you're doing, then do that, but then enlist mentors, someone that can help you, someone that can be your coach, possibly friend. I think that's huge.
So when you all decided to take the niche course, what was your ultimate goal with it, and did you achieve it?
Absolutely, yeah. When we decided to take the niche course, part of it I was kind of coerced into it just a little bit, and sometimes your ideas are not your ideas. They may be somebody else's ideas. In other words, another team member. They're called a team member for a reason. They're called a team member because you said we're going to be a team. So that means listening to other team members. This other team member that happens to be on my team made the decision that this is what we're going to do. And I heard her tell a story of us driving across the desert, and from one program that we've been involved in back to the 20th anniversary, an amazing event that happened at LVI. And little did I know that we would be involved with a man that I respect, a team I respect greatly, with Brad, or Dr. Durham's course. And I had no idea how much I was going to learn. I had no idea how much I thought I knew. But as they say, you don't know how much you don't know until you really find out you didn't know it, which is really the test. Because once you find out you didn't know it, now it's kind of like, that's the decision-making time. And the decision-making time is, it's okay that I don't know it. Maybe a little pissed off, but it's okay that I don't know it, but it's not okay to continue doing what we're doing. That's beyond insanity. It might be, I don't know. But the only way I knew that I could preserve, or especially after I spoken with Brad, someone I admire a lot, the only way I knew I could really preserve doing what we are doing, what we want to do, what I see myself doing, is I had to have systems in place. I clearly had to have a program that had a leader and a team, and that team had to be someone, and I think of it like sports and different things. Like you might have an offensive coach, you might have a defensive coach, you may have a coach overall, but they're all in an umbrella or forming a unity to where they're all moving everybody together. Now the main coach or owner may have to sit down and talk with me. In other words, Kent, we think you're the problem, says Brad. That did not happen to my face, at least. But if it is, I have to be okay with that. And I can't align with someone that cannot be honest with me and truthful and care about me, or at least that's what makes me tick. And that's what the niche program has really done.
Awesome.
The advice I would give someone who's really on the fence line on doing something like this, well, it's real simple. Do it. You cannot sit and think about it. You would just have to do it. Now, I know a lot of people that's probably watching this, they're not going to do that. They're going to, yeah, but it. Yeah, but it kills a lot of growth. Yeah, but it probably took a few years even where I could have been. So if you want the best recommendation of what I thought was right for me, because I don't know what's right for anybody else, but what I thought was right for me and what I know was right for me is you do it before you can think about it. You know, I was always told, you know, when's the best time you think about letting someone go, or maybe changing someone you date. And one of my old coaches from the 90s used to say, Kent, when do you think that is? And he would say, I said, well, I don't know. He says, the first time you think about it. Now, that's a pretty crazy idea, but if you're on the fence line about something, there's a reason you're on the fence line about something. And you cannot do it without a team. You can't.
So now looking at your practice and where you've come,
Sure.
you know, what would you say was the ultimate level of success that the niche helped you with?
Well, first of all, it is work. You know, you don't sign up for a program and not have to work. And so one of the key things that you really have to, that I've noticed that's been really instrumental for us, is it allowed me to concentrate on doing the kind of dental care or dental medical care that I enjoy doing. It also, this is kind of a biggie, it also, if you're in the midst of finding a new team or a new doctor, I'm kidding, but if you're in the midst of finding a new team, all of a sudden this kind of stuff will breed and you'll start attracting the people that want to climb on board with your bus. And that's big, because, you know, those days that things are just really getting to you, I've never had one of those, but I've heard about people. No, I'm kidding. But, you know, those days are when that other team member comes up to you and we've got this, or you have this. So it streamlined us. I mean, it's the big thing. It puts systems in place. And there are days that I have to go back and look at them. There are days that I definitely do not follow certain things, and I have it written down. And then I have other team members saying, okay, I'll help you, Doc, on this. And the financial rewards come, they just come. And you can't put a price on that. But if you're really on the fence line, you know, we have personal trainers, we have all these different coaches, therapists, and different things like this. How could I possibly, even with a business degree, how can I do something like this without someone to help coach? If Bill Dickerson's going to help us lead the way in our physiological approach, then, and we're already in a small, narrow field, then how are we supposed to know how to go even in another small, narrow field, i.e. running a business, running a practice, teaching this to patients? Well, I mean, how are we supposed to know that? So having a coach and having a team that helps all the other players on our field, you know, Jenny with other members in our office, and then management with other members in our office. In other words, you have a person or people assigned to help the whole business grow.